Hycamtin Vial is a medication used to treat ovarian, lung, or cervical cancer. It is a chemotherapy drug that works by slowing or stopping the growth of cancer cells. The dosage and timing of this medication will depend on the specific type of cancer being treated and the individual's medical condition. It is important to follow the instructions of the healthcare provider regarding the proper use of Hycamtin Vial. When using Hycamtin Vial, it is important to note that it should be administered by a healthcare professional. The medication is injected slowly into a vein over a period of 30 minutes. The dosage will vary depending on your medical condition, body size, lab test results, and how you respond to the treatment. It is crucial to follow the instructions of your healthcare provider and take the medication as directed. If you are using Hycamtin Vial, you may experience side effects such as nausea, vomiting, constipation, diarrhea, abdominal pain, weakness, tiredness, or mouth sores. If any of these effects persist or worsen, it's important to notify your doctor or pharmacist. While using this medication, it's important to be aware of potential serious side effects. Your doctor has prescribed this drug because they have determined that the benefit to you outweighs the risk of side effects. Your doctor will closely monitor you to decrease your risk. Contact your doctor immediately if you experience any serious side effects, such as pain, redness, or bruising at the injection site, or signs of lung problems like cough or shortness of breath. Although rare, a very serious allergic reaction to this drug can occur. Seek medical help right away if you notice symptoms of a serious allergic reaction, including rash, swelling, severe dizziness, or trouble breathing. This is not a complete list of possible side effects, so if you notice any other effects not listed, be sure to contact your doctor or pharmacist for further guidance. Topotecan, also known as Hycamtin Vial, can decrease bone marrow function, which may result in a low number of blood cells. This can lead to anemia, decreased ability to fight infection, and easy bruising or bleeding. If you experience unusual tiredness, pale skin, signs of infection, or easy bruising/bleeding, it's important to inform your doctor immediately. Your doctor will conduct blood tests to monitor your bone marrow function while you are taking this medication. It's crucial to attend all medical and lab appointments as recommended by your doctor. Before taking Hycamtin Vial, make sure to inform your doctor about any allergies you may have and discuss any inactive ingredients that may cause allergic reactions. Also, let your doctor know about your medical history, especially if you have kidney disease. This medication may cause weakness or tiredness, and using alcohol or marijuana can increase these effects. It's important to avoid driving, using heavy machinery, or engaging in activities that require alertness until you know how this medication affects you. Limiting alcoholic beverages is also recommended. If you use marijuana, it's important to speak to your doctor about it. Hycamtin Vial can also increase your risk of getting infections or make current infections worse. It's important to stay away from people who have contagious infections such as chickenpox, COVID-19, measles, or the flu. If you have been exposed to an infection, be sure to speak to your doctor for more guidance. Before receiving any vaccinations, make sure to inform your healthcare professional that you are using Hycamtin Vial. It's also important to avoid contact with individuals who have recently received live vaccines. To lower the risk of injury, be cautious with sharp objects and avoid participating in contact sports. If you are planning to have surgery, it's crucial to inform your doctor or dentist about all the medications you are currently using, including prescription drugs, non-prescription drugs, and herbal products. Hycamtin Vial may affect fertility in both males and females, so it's important to discuss any concerns with your doctor. If you are pregnant or planning to become pregnant, it's important to speak to your doctor about reliable forms of birth control. Women should inquire about birth control options during treatment and for 6 months after the last dose, while men should inquire about birth control options during treatment and for 3 months after the last dose. If you or your partner becomes pregnant, be sure to discuss the risks and benefits of this medication with your doctor. It is unclear whether this medication passes into breast milk, so it is not recommended to breastfeed while using Hycamtin Vial and for 1 week after stopping the medication. Be sure to consult your doctor before breastfeeding. When taking Hycamtin Vial, it's important to be aware of potential drug interactions that could affect how the medication works or increase the risk of serious side effects. It's important to keep a list of all the products you use, including prescription and non-prescription drugs, as well as herbal products, and share this list with your doctor and pharmacist. It's crucial not to start, stop, or change the dosage of any medicines without your doctor's approval. This will help ensure the safe and effective use of Hycamtin Vial. Make sure to discuss any concerns or questions with your healthcare provider. If someone has taken too much Hycamtin Vial and is experiencing severe symptoms like fainting or difficulty breathing, it's important to seek immediate medical help. In the U.S., you can call the local Poison Control Center at 1-800-222-1222, and in Canada, residents can call a provincial poison control center. It's important to act quickly in these situations to ensure the best possible outcome. It is important to undergo lab and medical tests, such as a complete blood count and kidney/liver function tests, while taking Hycamtin Vial. Make sure to keep all your medical and lab appointments and consult your doctor for more details. Be sure to take Hycamtin Vial exactly as prescribed by your doctor. If you happen to miss a dose, make sure to consult with your healthcare professional to determine the best course of action. This medication is given in a clinic and will not be stored at home. This medication is used to treat advanced ovarian cancer, small cell lung cancer, and AIDS-related Kaposi sarcoma. The dosage and timing of this medication will be determined by your doctor. It is important to follow their instructions carefully. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.